Wonderful. Welcome. We were just talking about this. I want to give a little shout out to everybody who is watching this video while going for a walk or doing the dishes or sitting on the couch. I definitely support everyone in watching this as they please. I have a lot of people who watch the videos. I can see the numbers that most people watch the videos. And I have people come in and say that they're sorry that they don't come in person. And I just want to say that this is a resource that I want to be available for people, and I want them to engage with it however is best for them. So if you are doing the dishes right now, that's wonderful. And even if you do want to come on the Zoom, it is always okay to keep your camera off if you prefer. So welcome. In doing this class about memory, there's just so many fascinating things when we talk about memory and when we really think about what memory is. So we have a lot of focus often on memory loss or word finding issues or things like that. But when you really stop and think about the fact that you could sit here right now and remember something from your childhood in pretty great detail, and you can kind of think about what it smells like, what it looks like, what it feels like, that's pretty incredible, actually. And what's happening there is you're actually firing a set of neurons. It's almost like if you think about a symphony, if there's like you have lots of instruments, but they can fire in a certain way. I mean, they can make noises in a certain way, so it makes a certain song that you recognize. It's a lot like that with neurons. So when you're reaching back for a memory, you're actually kind of firing those neurons in a certain pattern that makes you have that memory. There's a lot we don't understand about memory. Between memory and dreams, they're actually there's like a lot of interplay between the two, and the amount that we understand is probably, it's like this much, like a little tiny bit, maybe. Yeah, and not even, and it's fascinating. A lot of what we learn is actually from people who've had brain injuries. I don't know if you've read any Oliver Sacks, or those books are really interesting because they look at people with brain injuries and how those brain injuries actually teach us about how the brain works, and how also the brain can adapt. And so really, when we think about memory, I just want to sort of like look at that big picture. The other thing I really want to bring into this conversation about memory is that something happens where, sort of people focus a little bit more on actually really Alzheimer's and dementia is really the boogeyman of for many people. Like, this is the worst possible thing. They've seen loved ones go through this really awful experience. They've gone through this awful experience with someone. And so the study that I really always want to bring out is this one where they actually did a thing where I couldn't find the study, but I remember reading it way back and I've been thinking about it ever since. So they basically they had people wear a camera all day long, and they counted how many times they forgot something, either like a word finding issue, and they kind of categorized it by like word finding issue, or forgot why they went into a room, forgot why what they were talking about, these kinds of things. And they had people of all different ages. And so what they did at the end was they put together all the how many times that people forget things. And what was remarkable was it was very similar across the age ranges. So that was kind of a surprise. And then the other thing was the fascinating thing was that then they had people self-report how many times they forgot something or how often they forget things. And in that particular day, how many times did they forget something? The people who were, late 50s, 60s and above could remember every time that they forgot something. The people who were, like 40, 50 and below, said, oh, I didn't really forget anything, like they're very underreported their memory challenges. And so what this really tells us is that, there's a stress response that happens for a lot of people when they're having trouble remembering something, especially if they're 60 and above, because there's a constant question of like, what does this mean? What does this indicate in terms of like my risk of developing Alzheimer's or dementia, or am I already, or, and I get a lot of people asking me questions about that. And so I just really want to kind of point out that that what we want to sort of, it's good to kind of pay attention to other people forgetting, especially people who are, sort of not in the age range where that's a concern. And just to remember that actually, that really we all kind of have those simple forgetting things quite often. The things we want to watch for in terms of red flags for whether or not there is a bigger memory problem, something that's kind of moving towards Alzheimer's dementia, is when First is if people, get really disoriented. So if they end up in a place where they know well, but they can't figure out how to get home, or they're not quite sure how they got there. And others, if they pick up a tool, so they have a key and they look at it and they don't really know what to do with it. And also if they start doing simple tasks that they have done a lot of times and they have trouble completing that task. And that doesn't really count for times where there's great upheaval, whether that's moving or the passing of a spouse or a loved one. That doesn't really count in that situation. A lot of times people get their ability to do those simple things gets a little bit compromised. And then of course, there's, the repeating oneself in the same conversation, that's something to kind of pay attention to, but very often I've seen that resolve with better sleep as well. So that's my little sort of intro there. And I think that what's really important in this class, this is not a class that's really about Alzheimer's or dementia prevention. It's really about memory support in the here and now. We will have a class later that's really about, but this is kind of like, there's going to be a little bit of, crossover between those two classes, but I just wanted to make this one really about, memory itself, because it's really important to kind of cover the causes of memory loss before we start going directly to talking about Alzheimer's dementia. Because for most people, if they're having memory problems, the first thing that comes to mind is Alzheimer's or dementia, when really, actually, this list of things that are the common causes of memory loss are actually much more common as causes. So the biggest one I should have put like underline, star, is inadequate sleep or sleep apnea. So as a cause of memory loss. So this can happen in a short-term kind of a way, like if people travel or they have guests and they just stay up too late, they often will notice that they have just sort of a little bit more difficulty with word recall, name recall, being able to remember when they walk into a room what they came in for, those kinds of things. And the reason for that is this pretty fascinating thing. So basically, what happens is when you have an experience, it goes into your hippocampus, which is kind of a part inside in the middle part of your brain. And then what they found is that when you get into this deeper level of sleep, the hippocampus kind of replays. Basically, what they can see is the same patterns that it had during the experience itself. It sort of replays it, but faster, in order for it to get sort of stored in the neocortex. So it kind of like transfers I hate to use the word data because I don't like to think about computers, but transfers that information or that experience into the neocortex. And the neocortex is the bigger part of the brain where it all gets kind of stored and kept. And sort of like the way I think about it is that while you're sleeping, your brain files everything away. So it puts it into a good filing system. And if you don't get enough sleep, that process isn't really able to happen in the same way. Or if you have sleep apnea, that doesn't let you kind of get into levels of sleep. I guess another, if you drink caffeine and you don't get into deeper levels of sleep, or all of the reasons that we've talked about in the sleep workshop about why that might be. I'm actually going to put a mute on here if that's okay. Well, perfect. You did it. Ta-da! Thanks. So really, this can mean, anywhere from like getting less than 7 hours of sleep to someone, having a few drinks before bed on a regular basis that makes them have difficulty sleeping. So really sleep quality is as important as sleep quantity when we're talking about memory. So very often this is my first go-to is to look at a person's sleep when they're talking about memory difficulties. B12 deficiency is another big one that comes up a lot. B12 is a really complex nutrient to absorb. And so it's actually more common as time through decades. And that's because of the way that you have to do this whole thing with intrinsic factor, and then it has to be absorbed. And there's lots of different things that can become problematic in that absorption process. And so B12 deficiency can cause quite a lot of memory loss, and also is very common, especially in people really over the age of 60. Hypothyroidism is another one. So hypothyroidism is your thyroid really controls metabolism and so much signaling in your body about and wakefulness as well. So when people have hypothyroidism, which means their thyroid is running a little bit slow, they often will have some cognitive changes and some memory difficulties. And really, when people come in and they have kind of a newer onset memory difficulty and they don't really have trouble sleeping or those kinds of things, I often do want to check their thyroid to see what's happening there. Medications, there's a lot of medications that can cause memory difficulties as a side effect. I'm not going to go through all of them just because that would kind of take a while to talk about mechanisms and everything, but just that's something that we're often looking at in the office, is whether or not there's an association there. Alcohol consumption. So there's a couple reasons for that, that the alcohol consumption does shift sort of your sleep and how the depth of your sleep. So actually the when you drink alcohol, people often think, oh, it helps me get to sleep. I get to sleep faster when I've been drinking alcohol, but actually the quality of your sleep when you've been drinking alcohol is not as deep. And so that can affect your memory in that way. There's also some other ways that it can affect memory, but really the big one I think about the most is really about how it affects sleep. And also it depletes certain nutrients that are really important for memory. So that's like thiamine and riboflavin, and kind of a severe thiamine deficiency, it presents as a really wild, sometimes there's, the person is like, there's speech difficulty, but also sometimes there's kind of a, lots of big stories. So it's an interesting thing of the way that that it affects memory very, very kind of directly in a lot of ways. And then stress, anxiety, or depression all can present with memory difficulties. That's partly because of how their cognition changes. In terms of the way that I treat for that, sometimes what I see is it's really a person is having not enough dopamine. So those for people who don't have enough dopamine, they're the ones who are sort of looking to alcohol, caffeine, cigarettes, those kinds of things. But also who kind of have a general blah kind of feeling and have trouble going from one activity to the other. And really when we're talking about dopamine, it's really an issue. When we think about memory, for like a subjective experience of memory, it's often like, oh, I just can't remember how to do that thing, or I just forgot that thing. But very often there's, when they look at the literature about it, they divide it up into like spatial memory. There's all different kind of categories, and one of them really is about attention. And so there's sort of a difference between memory and attention. So sometimes what's really happening is that back to that kind of image of the hippocampus kind of filing things away in the neocortex. Sometimes it's an issue of the filing, but then it's also sometimes it's an issue of the person going to find, or not the person, but the going to find that file. And really that's when there's a dopamine issue, and it's kind of hard to go back and find that memory. So it's actually more of an attention, recall can be kind of about also attention. So it's a lot of complexity there but also the other thing to kind of bring into play there in terms of stress and memory is that when people's cortisol is high, the best way I like to think about it is that, that is a stress hormone. So your body is saying there's a stressful event happening right now. I need to focus in on what's happening at this very moment. And I'm not going to really be sitting here remembering, my to-do list, but I'm going to be a little bit hyper-focused on this. And what people often experience is that they have difficulty again with attention, but they also have difficulty with some of the recall. And that's partially because their cortisol is high. So their signal is that recall is not as important right now. So it sort of de-emphasizes this recall activity. So a lot of, another major place that I end up treating people for memory is really in modulation of cortisol. And so that's those herbs that we've talked about before that I use quite often: ashwagandha, rhodiola, magnolia. A lot of those really work with that cortisol system. And we're really modulating the cortisol so that a person, when the cortisol is down in a good place, that person can go back and find that memory, do that recall action, and they're good to go. Also, they find that often that their attention is a lot better on tasks that are in front of them. So any questions about those things? No. So this is really when this list up here is mostly where the vast majority of my practice, when people come in talking about memory, this is often where I'm hanging out, is in those causes that I was talking about. And each of the causes of, there's treatments based on the cause for each of those, obviously. But then, sort of like wanting to look at, because people often want to know about actual, like what they can do to help their memory, to really support their memory. So I kind of went through that. And the caveat here is that because Alzheimer's and dementia is the boogeyman of kind of modern day where we are in medicine. You know, people are living longer. You know, people don't die of infection as often as they have in the past. Here we are with like, this is the kind of the big scary for many people about it, you know, so there's a whole business of selling these memory supplements. And when you dig into the primary literature, so when you read about them, you'll see this like kind of, again, these sort of fake articles that is like written by people who are trying to sell a supplement, and they'll say, oh, you know, this has been shown to blah 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 blah, and that's a very complex statement, because has been shown to can mean it was shown to do this in a test tube, or it was shown to do this in mice, or they're shown to do this in, you know, and it could mean 5 mice, you know, like, or 5 people, you know. So it's really, you know, when people are trying to sell a supplement, a lot of times the literature that they're working off of is dubious at best. So really, I highly recommend, you know, going into any thought about a memory supplement with a big, you know, sort of hesitation or big level of skepticism. What we find with these is that because people are so concerned about memory issues, that people will charge, you know, $100 a bottle for this stuff, and really very often it's things that, you know, are not well supported by literature, but also that, you know, may or may not be safe. So just to define a couple things that will come up in the conversation about these different herbs, the acetylcholine esterase inhibition, which is often written as ACHE inhibition. What that means is that there's an enzyme, acetylcholine is a really important, you know, molecule in your brain that helps with cognition and memory. And so there's an enzyme that breaks down that acetylcholine. And so one of the things that is happening when people have memory problems is that they don't have enough acetylcholine. And so it's really like, how do we keep more, you know, how do we get more acetylcholine? And one of the ways to do it is to get it to be broken down less rapidly. So whenever we inhibit the enzyme that breaks down the acetylcholine, now there's more acetylcholine there because it's not getting broken down so quickly. So there's a lot of these herbs that have some acetylcholine esterase inhibition. There's a lot of therapeutic targets for medications that they're developing are really about this effect on acetylcholine esterase. And so just knowing that is, you know, part of what we'll see when we're talking about certain herbs here. And then amyloid plaques. So there's this kind of big process happening right now, is that, so basically what they notice is that people with, they notice that people with Alzheimer's have these plaques on their brains, they're amyloid plaques, beta amyloid plaques. And one of the, so they notice this correlation between most people with Alzheimer's have these plaques. So then they said, oh, the plaques must be part of the problem that's kind of causing all of the issues. So if we get rid of the plaques, we should be able to get rid of Alzheimer's. And that's been the kind of like guiding theory, is that the target is to get rid of the plaques. And also some of what that's starting to shift, because one of the things that they're noticing is that there's a lot of different therapeutics that are really good at getting rid of plaques, but that doesn't mean that person's memory is a whole lot better. So there's kind of a, you know, there's this sort of big question right now of, are the plaques a symptom, or are they sort of like causative in the pathophysiology, which basically means the process by which something happens. So all that to say, there's a, you know, the focus has been about plaques, and you know, but now we're kind of looking at that as one of the many things that we want to think about, and not necessarily something you know, that is as focused on in terms of like a therapeutic target. It still is, you know, definitely still is. There's still a lot of people who kind of like are doing this research and doing this kind of work with the hypothesis that the plaques are really the most important thing here. And there's a lot of people questioning that at this point too. So this field is one of those ones that people are working on very hard, and there's, you know, still working on it is really the there's a lot we don't know at the same time. So in terms of things that we can do, you know, in terms of herbs and nutrients, one of the things you'll notice here is that with a lot of these herbs that are like more of the household herbs, I do not have dosages for them because they really don't, turmeric in certain forms can have dosages, but a lot of them don't really have like a dosage associated with them, but just more of like if we incorporate more of these into our diet, that's a good thing. And that's partially because we don't really have the data we can see what their mechanism of action is, but we don't have the data to say, well, how much would a person need to take in order to have that full effect. But blueberries, they're good old blueberries. I feel like they come up with like literally everything. It's been kind of like a funny thing to just sort of notice that they really can do everything. So there's a lot of different flavonoids that are being studied for treatment of prevention treatment of Alzheimer's. And so because there's a lot of focus right now on when we talked about like pro-oxidants, so those free radicals, those are the things that sort of go around and cause irritation and sort of inflammation everywhere. And so those are cruising around, and they seem to be a major factor in terms of the development of Alzheimer's and the sort of decline of the brain. And so blueberries, being the powerful antioxidant that they are, actually can counteract some of that process. And there's a couple of studies done on blueberries. One of them that specifically was where they gave people extra blueberry juice and had them drink that, and 12 weeks later they could show that they had cognitive improvement. So I think they did the juice because then they could do like a placebo. It was like a flavored blueberry juice. And so but pretty much blueberries, here they show up again. And this actually kind of does bring into focus the fact that there's a lot of people talking about Alzheimer's being diabetes, type 3 diabetes, which is an interesting kind of frame to put on it. So basically the idea being that that Alzheimer's really comes from the things that we're exposed to, or the things that we ingest that have that pro-oxidant quality to them, including sugar, because sugar actually does, especially when your blood sugar is high, your neural tissue is one of the tissues that is most sensitive to high blood sugars. And that's partially because your brain doesn't work on an insulin system. So it just gets really affected the most by ups and downs in blood sugar. And that's really, you can probably experience it, speak to that experience personally, if you have the big pancake breakfast with syrup, and how you feel, that's really your brain saying like too much sugar. Or similarly, if you haven't eaten in a long time, the kind of those kinds of changes can really be about your blood sugar being too low. So really blueberries, again, kind of coming back in with, because they are also so effective in kind of a metabolic syndrome and working with your blood vessels, as well as your blood sugar regulation, as well as that antioxidant effect. They're just doing all kinds of good things. So turmeric is one that is a really incredible medicinal spice that one of the challenges of it is that it's really hard to absorb. So it does all these great things, but we have to figure out ways to make it more absorbable. And there's a bunch of companies that have made it into this lipid soluble form. So Mariva and Theracurmin and all of those. And then if you read anybody's supplement, anybody's, again, quote unquote article, they're going to say that their turmeric is the best absorbed of all of them. And so the actual data does support those two ones, the Mariva and the Theracurmin. And they've actually, there's been multiple studies showing that giving people turmeric can help cause cognitive improvement, even in people with pretty advanced Alzheimer's and dementia, which is very significant because that's not something that, most trials, when we're looking at actually, with people who have advanced Alzheimer's and dementia, it's really hard to bring that back or to reduce that in any way with medications or with really anything. But turmeric does do quite a lot for that. Incrementally. Saffron. So saffron has been shown, this is probably one that will come up more. It's sort of like in research phases of having, because it does have anti-amyloid properties, which means it helps to reduce those plaques or prevent them from forming. Has antioxidant properties, and it has acetylcholine esterase inhibition. So it kind of does all those, and also is anti-inflammatory as well. So there's, saffron is one that is, being more and more studies are happening regarding it and brain health and memory support. Again, using it as a kitchen herb is only going to be beneficial, but it's, but in terms of getting it in dosages, the dosage question is still very much up in the air. So, and really, when I look at all of these, all these herbs and everything, it's what I'm hoping for people to get from this is, both the things that they can do, like, working on sleep and exercise as always, but also, just sort of incorporating all kinds of spices into their food is always a wonderful thing. And so, just finding recipes that have a little bit more turmeric or a little bit more saffron or ginger, really great ways to make things even better for your body. So ginger, it inhibits neuroinflammation and reduces activation of microglia. So microglia are kind of like the cleanup cells in your brain, and they haven't really been given a whole lot of attention until more recently. So basically they can kind of be, they can sort of fulfill, they can do a lot of different things in the brain, but one aspect of what they can do is if they're overactivated, they can actually be pretty destructive. And so there's a lot of different sort of research going into why do they get overactivated, how do they get overactivated and what can we do about it. There's a really wonderful book. It's one of those books that's science but written in a very approachable way, called The Angel and the Assassin. It's all about microglia, and super fascinating conversation about not only the sort of like environmental or different effects, but also just the effects of things like stress and all of that too. But it's not one of those books that basically is like stress is bad. It's more like sort of looking at a lot of the nuances there. So great book. The cinnamon, also it has a lot of blood sugar regulating effects. So it really helps with, like we've talked about with insulin resistance and everything else. So it helps in that regard, but it also has antioxidant and anti-amyloid properties as well. So and cinnamon's a great one to add to all kinds of foods, people, adding it to your coffee or to your, if you're making, one of my favorite things is to take apples and just cook them up with a little bit of cinnamon, and it feels like you're having apple pie, but it's just apples and cinnamon. And it's really quite lovely. And then black pepper, actually. So good old black pepper. So it inhibits the acetylcholine esterase. And also if you're using other spices, particularly turmeric is the one that's been the most studied, it actually helps you absorb a lot of more nutrients from your food in general, but specifically turmeric is one of the big ones that it really helps you with absorption. I actually don't know how it does that. Now that I wrote, and now that I'm thinking about that a little bit deeper, I'm like, I'm not sure how that works, but it does. And so, and this is kind of an important one, is that, I mentioned about the mouse studies. There's a lot of these things that are on mouse studies, and that's fraught, really, like in a lot of ways, because it's pretty hard to study memory in people, right? Because it's so complicated, it's so multifactorial. Even in the moment that you're doing a double-blind placebo-controlled trial, does that person feel comfortable with the person who is asking them the questions? And that can affect how well they can recall in their memory. Do they feel cold? like while they're doing this testing, it's like all of these things can be playing into this. It's actually pretty hard to study in I mean, there's a lot of evidence-based ways of studying, but then even harder when you think about how do we apply this to, kind of an animal model, and really, how can you tell if there's ways you can tell certain kinds of memory in a mouse, like do they remember how to go through a maze, but that's really different than things like, you can't ask your mouse about word recall, like that's, I mean, maybe we could, you could try, but yeah, so pretty much, all the animal studies get pretty fraught, but it is kind of how we get to know some of these mechanisms of how things work. And then sage. So sage is a good, it's a memory supporter. So a cup of sage tea is lovely. Rosemary is actually the other one that I didn't put on here, because actually there isn't as much research about it, but just the smell of rosemary is in old school herbalism. This is not coming from the data, actually can help your memory. And I think it really just kind of like makes you feel a little bit more alert, and so therefore a little bit more better memory. And so, oh, I just noticed a typo there. Sorry about that. It says Ben instead of bin, shown to improve. So, really sage tea, lovely. I don't recommend it for people who are breastfeeding though, because it can actually reduce the breast milk production. Green tea. So actually caffeine is something that to touch base about, is that caffeine, coffee, all of it has been shown to improve cognitive performance and in memory and recall. And so the one sort of like little subheading there would be that except for when it affects sleep. So when people are drinking caffeine and then they're not sleeping as well or as much, then it actually has a net negative effect. But in terms of just sort of in a really direct manner, it does improve cognitive performance. And most people can probably personally relate to that, just that like suddenly, things that caffeine can help brain work a little bit better and sort of that recall happen a little bit better. Green tea is interesting because it also contains this L-theanine, which has been shown to help with both the focus and attention part of memory. And so it's this combination of caffeine and L-theanine. They actually have shown that even decaf green tea has a cognitive, it improves cognitive performance. And so really, a cup of green tea, put a little sage in there, is a great thing, for so many reasons. It also has like anti-cancer properties and blood sugar supportive properties, and so it's definitely this is another reason why green tea is a good thing to kind of incorporate in your routines whenever possible. Lion's mane is a mushroom that I use quite a bit, actually, especially for when people are experiencing brain fog after an infection. So lion's mane has a couple of different things that are really specific to that kind of post-infectious brain fog. We see it a lot with like Epstein-Barr virus and with COVID and also kind of other forms of brain fog can really respond well to lion's mane. So a couple of things that it's been shown to do. One is to help regrow nerves, and so so even just like when people have had like a nerve injury or a surgery and they're having some weird nerve response to that, lion's mane is really wonderful for that. So it actually increases the release of this nerve growth factor, which helps you grow more nerves. The other thing is that it reduces inflammation in the brain. So if that microglia sort of question that comes up about whether or not the microglia themselves are being a little destructive to the brain, lion's mane actually will counteract that and make it a little bit less inflammation in the brain. So it's a great, it's generally recognized as safe, which means it's really like a food product. It's in a lot of, there's a lot of different combinations of lion's mane, reishi, cordyceps. Like mud water is one that people like quite a bit. That one does have a little bit of caffeine in it. There's one that's made by Sunwink that has some lion's mane in it that is like a cacao and lion's mane and reishi, I believe. I haven't actually personally tasted either one of them, but the formulas are good. And definitely, I'm not worried about those in terms of from a safety perspective. They definitely, there's a lot of good data about these mushrooms, and also we can know that they're pretty safe. That people do eat them in food quantities, and that tells us, and also we know that there's no like long-term negative effects there. And then omega-3 fatty acid supplement is, good for a lot of different reasons. For people with ADHD, it does help a lot with focus and attention, partially because of the way that it modulates cortisol, actually. So that's one area that we see that helpful in memory because of for people with ADHD specifically, or people with high cortisol. The other place that it's really kind of shines is in people with this ApoE4 gene mutation. That's really that's ApoE4 gene mutation, and I think that is on the 23andMe. Some people don't want to know whether they have that, so I don't know if they put it on the 23andMe. But it's a gene mutation for people who have like a really huge family history of Alzheimer's or a history of like early Alzheimer's or dementia. They will often get a test for this ApoE4. gene mutation. And for folks who have that mutation, it's good to get extra omega-3 fatty acids, especially. And also, even if you don't want to know whether you have that gene mutation, or you don't know if you have that gene mutation, if you know you have a big family history of Alzheimer's and dementia, that, you know, getting a little extra omega-3s is a really good idea. And by the, you know, by the mechanism that it omega-3s help to modulate cortisol, I do actually find that people note that they have more cognitive improvement with omega-3 fatty acid supplementation. Although that being said, in the actual literature, it's not really a direct correlation that has been found. So more of a clinical observation, and also clinical observation that people's cortisol often goes down when they eat more omega-3 fatty acids as well. So any questions about all of those things?
Yes. I noticed, I'm hoping it's in your handout, because there are certain long words you use that just go real, and I can't jot them down. But I was interested in the lion's mane. Can you take that as a tea and tea?
Mm-hmm. Yep. So there's a what is the trying to remember the name of the company that makes a tea with lion's mane in it. It's called hold on one second. Recall. Here it is. Host Defense, it's called, and that's Paul Stamets who runs that company, and he does a lot of the NIH, National Institute of Health research about mushrooms. So he's really got, you know, in terms of like how they're grown, and, you know, there has to be a lot of carefulness about how they're grown. But he has a powder that with lion's mane that you can add to teas, and you can also, or you can make, you know, add to a smoothie or to tea. And then there's also a lot of these products that actually, you know, sort of are made to be like a tea. So there's Four Sigmatic is a company that's making a lot of different, you know, sort of mushroom type drinks. And they've come a long way in terms of, they used to taste really gross and earthy, but now they've like actually made them sort of pretty palatable. So usually so in terms of like a tea where you like, the hot water extracts the nutrients, with lion's mane, it is better to actually get to be ingesting the actual plant itself. And so that's where getting a powder that you kind of mix into something.
Oh, okay.
Yeah. And that can be, you know, some people just take it and mix it into their coffee. And there's also these ones that are made to be like a coffee beverage with that already added. So
is there a chance that could help with numbness, if you're getting numbness?
Yep. I've used it a lot in that regard. Mm-hmm.
Okay. Yep. And I don't know if you remember, but I take the turmeric and algae.
Mm-hmm. Yeah.
Seaweed, and I forget, there's a GABA something in that, mm-hmm. that I picked up from Dr. Ammon, mm-hmm. a book years and years ago.
Yeah.
That chemical, I don't know if it's a hormone or what, but in the seaweed, and I definitely see a difference with word loss. Mm-hmm. But I recently kicked up the turmeric. I've added another one in because I was noticing more word loss, but again, it's probably not enough sleep. Mm-hmm. So I'm not sure what you can say about the algae, mm-hmm. if that would have helped other people.
Yeah, definitely. Yeah. So there's a couple of different things that fall into that category of things that support that GABA production. So theanine is one of them. It's kind of, theanine is of those ones, it's like the most studied, is like direct theanine, which is in the green tea, and you can also get like a theanine extract that's just L-theanine. The algae have this kind of these different sort of active components that support GABA production, or actually sort of mimic GABA, or sort of help you produce GABA. And so I think actually some of the algae actually have L-theanine in them as well. And so really it's kind of all by that mechanism. So it's kind of the algae itself is really doing a lot of the same things that the L-theanine is. in terms of, so GABA actually, and actually to kind of go one step behind, GABA is the neurotransmitter that has kind of more of a calming effect on the nervous system. And so that actually, what it's helping more with that when we're talking about recall and word recall, a lot of it is about attention. And so, and one of the ways that we can see this the most is, you ever notice when like you're trying to recall something and then you're like kind of getting more stressed about it, it's even harder to catch it, like it just sort of gets farther away. But then that moment that you kind of stop thinking about it, or the moment that you're like going to sleep at night, all of a sudden, boom, there it's there. And that's a really good example of what happens with GABA, is that, that calming neurotransmitter makes it so that we can actually sort of do that attention piece and find that file.
Let it flow.
Yeah, exactly. Yep. Totally. Which actually you'll see, we'll talk about meditation as well. And very similarly, that is doing a very similar thing in terms of making that flow, finding that state where there's not, where there's, sort of more attention and ability to sort of direct attention. And then that helps a lot with recall as well. So yeah, thank you for bringing up that. Ammon Clinic does have a lot of great research happening and great information about brain health. I mean, I think they've really, moved the whole field of brain health forward. They, at this point, they are selling a lot of supplements. So it's kind of like, there's this sort of mixed thing there of I saw they were talking about Bacopa in a way that sounded a little bit more well-researched than it actually is. So there's this little like, like just sort of with that caveat of like they're selling the supplements, and sometimes they might overstate a little bit what the research is saying. And also the other thing that I know about them is that they're also speaking from clinical experience. And so they might, even though the actual like published literature about Bacopa might be pretty minimal, they might say, hey, we've seen this time and time again in our clinic, is that people respond well to Bacopa and there's no really big side effects. So they have a vast clinical experience on that one. So yeah. So just the kind of, here's more of like what you can really do about memory. Adequate sleep, 7 to 8 hours of sleep is necessary for attention and concentration, as well as memory consolidation. So that the whole activity we talked about the short-term memories being kind of like transmitted to the brain from the hippocampus to the brain, that really requires that time sleeping and that deeper sleep. One of the things that, really, one of the first things that I see, as a symptom of sleep deprivation, whether it's because a person got a new puppy or because they, are, have a partner who snores, or, any of those things, any reason that there's sleep deprivation, is often that they'll come in and say, I'm really having trouble with my memory. The other thing I didn't really, on that same front, that I didn't really bring in is about how often I see people when they're in acute stages of grief, going through major memory challenges. And, the way that I think about that is that the brain, just that we're working so hard emotionally, mentally, physically at sort of figuring out, sort of finding the world without that person in it, and sort of finding a place in the world without that person in it, that stuff, that sort of that work of like finding files and, going to the, finding memories, and even just sort of like maintaining concentration gets really impacted. And acute grief is not the only place that happens. It can happen with major changes, like when people move from one place to another. I also see it happen then, is that very often, within that first, 3 months, because even with something like a move, a person is now no longer just doing sort of like the routines. They're not able to just sort of like click into a routine and do that, and then the rest they can think about the rest of their life. They're having to put a lot of cognitive effort into just the daily activity. How do I get to the grocery store? Where is that fork? Or where, in this new kitchen, or, anything like that. Any kind of major change can really cause some difficulty with recall. And that's partially because there's just so much cognitive activity having to happen throughout the day that it can get harder to, for the brain to be doing more things than, the attention, it kind of shifts a little bit. So just to put that out there, if people are experiencing a lot of memory difficulties, with acute grief, I usually say, wait 3 to 6 months, and just then we'll kind of revisit this. I often will do the mini cog test in the office just so everybody, just so we know we like kind of that often half the reason I do it is to offer reassurance for that person to know that that's not a sign that they're, going through early signs of Alzheimer's or dementia, that really it's about what's happening. And just by the same way that the depression itself can cause memory difficulties, that's another way that we see, serotonin and dopamine do have a lot to do with memory and recall and sleep and dreams. And so there's a lot of ways that they're kind of from all different directions that memory is being affected. And then exercise. So really, of all the medicines that there are for memory, I would say exercise hits the top of the list. And we're not talking about heavy duty, hardcore exercise. We're talking about 120 minutes of walking per week. So that's 2 hours. So, that's really, we're not talking about a whole lot. And that's what has been shown to make a difference in people's memory. It does a lot of different things. So one is it improves circulation to the brain, but also there's been studies showing that they take people who don't exercise and they have them exercise, and they can see that actually they have nerve growth, especially in their hippocampus. So they're basically, that it gets more, there's actual growth of nerves. And that's a big thing, is like, so if we have this whole issue about like inflammation and microglia causing some tissue destruction or impairment, the fact of actually having nerve growth is really like a great way to counteract that process. This quote really about from that study is that prospective studies indicate that physical inactivity is one of the most common preventable risk factors for developing Alzheimer's dementia and Alzheimer's disease, and that higher physical activity levels are associated with a reduced risk of development of disease. Exercise as a treatment for Alzheimer's disease shows improvement in cognitive function, decreased neuropsychiatric symptoms, and a slower decline in activities of daily living. So basically, really, also, there's so many different measures that they use in these cognitive research, but this decline in activities of daily living, what that's telling you is that for a person who is actually having trouble with memory, that this actually allows them to be able to do all of their normal activities, live independently for as long as possible, which is really, for a lot of people, when it comes down to it, one of the biggest sort of markers of quality of life is being able to continue doing things for themselves and living kind of doing their daily activities. So and on a very short term kind of a way, I think we've all experienced that if we work out in the morning, like just everything works better all day. So my brain works better. Yeah. And it works better than caffeine, like that definitely, I've done that personal experiment is like exercise definitely outperforms caffeine in terms of brain function. And it's just so wonderful to start the day with a workout or a walk. That is one form of exercise, but so and then dietarily, this is sort of I feel like a broken record, but it all does come back to vegetables and whole foods and good healthy fats and things like that, and specifically the studies have been done on a Mediterranean diet, which really Mediterranean diet, the sort of like the overview of it is that like the sugar intake is really low. There's a lot of the less starchy vegetables, lots of fish and fish that are high in omega-3s, good healthy fatty acids that are come from plants and from fish and from leaner proteins. The little bit, the Mediterranean diet has less of the intake of red meat and dairy products than is kind of in the standard American diet. And then 4 to 6 cups of vegetables a day. So if that all seems overwhelming, the thing that I always encourage people to focus on is that 4 to 6 cups of vegetables a day. It's a really good sort of, goal to try to hit, is because if you're eating 4 to 6 cups of vegetables per day, like a lot of other things sort of can fall by the wayside there. But then, that's a good sort of goal piece to use, because when we get into these dietary things, so many of them are focused on weight loss as the as the like, ultimate goal. And there's so many things that are done in the name of weight loss that are actually deeply unhealthy. And so when we kind of look at, things like Mediterranean diet and really what we're seeing in terms of the outcomes, in terms of heart health and everything, so much of it is really about that, sort of all of the different, components of all the vegetables that people are eating on that particular diet. So, meditation. Meditation has been shown to improve memory, reduce stress responses, and support sleep. So really kind of hits all of the markers. And really when they do this research on meditation, they over and over again, they find that people get the benefits, by doing 10 minutes a day, which is so not huge amount. A lot of people say like, I can't meditate because I don't have time for that. But really when we're getting into these 5 and 10 minute increments, there's a couple, I've listed a few apps that I like here, Headspace and Stop, Breathe, and Think. And those are really good resources, but there's lots and lots of, Insight Timer is another great one. We can find lots of different meditations, the Calm app. 10% Happier is the one that you recommended. Yeah, that's a good one too. I've been watching some things on that. So there's just lots of great resources out there. Meditation can look as simple as sort of like sitting quietly and focusing on the breath. That can be, if you want to keep it real simple, that's where you can go. But also there's a lot of really nice guided meditations as well. So really what's happening with meditation, the way I think about it is like is training attention and training yourself to be a little bit detached from what you think is happening, to sort of have like a little bit of space there so that you can be sort of like discerning, kind of, or not discerning, but like just sort of more so that you're kind of holding that, like kind of that big picture and sort of being able to focus your attention where you choose to focus your attention. But there's a lot of other layers to meditation, but that's kind of in terms of something like this, that I feel like that's one of the ways that it's really therapeutic. I don't know if you have anything you'd like to add to that or say about that.
It's really good for focus, I think. It's been helping me with paying attention to what I'm doing, because a lot of the meditations say just focusing on the breath, let's say, and it clarifies your brain. And even when I was out jogging today, sometimes my brain goes off and I think, well, you better be paying attention to what you're doing. And so you bring it down. What is the catchphrase about that? Mindfulness. Mindfulness is but it really helps with mindfulness, I think. So it's very useful to me, and I miss it if I don't get it. Just like jogging. If I don't jog, I miss that too. So.
Right? Isn't it amazing what a difference? There's remember that saying, I don't know who to attribute it to, but it's the one that's like, if you miss one day, it. If you miss 2 days, I think it's like your closest, or wait, something about like your practice, your work shows it or something. But then if you miss 3 days, like everybody knows it. Like everybody
yeah.
It's like, right. I definitely feel that things start to unravel a little bit. And also I just feel like meditation is such an important sort of counterbalance to modern life, so we have like all the dings and the beeps and the things that are sort of pulling our attention in 20 different directions, and the sheer pace of life, and so meditation is such an important counterbalance to that, and to really helping our ability to like shine the flashlight of attention in different places.
I've also discovered something neat in Calm. I began exploring Calm too, and the Daily Move.
Oh,
wonderful Asian lady gives you just 3 little moves every day, and sometimes she'll do something that looks like extreme yoga, but you don't have to obviously do exactly what she does. But and a lot of it works in Tai Chi. It works in all these Asian disciplines. She'll pull out of her hat I've never heard of, but it's even moves simply of palms up, palms down, cross, and so she then has you breathe, and they do this cool thing as she breathes out. the circle comes out of her. So you get this sense of breathing out. But it's only 5 minutes, 5 to 6 minutes or something, but it gets you moving.
Yeah, wow. And it sounds like she's really pulling from all different kinds of traditions and yeah, like all different. Wow, that's fascinating. I totally want to check it out. Huh?
Yeah, so go to Calm and then the Daily Move, and she's terrific.
Wow, right.
It's real fast, and you feel like, well, I at least did that today.
Yeah, totally.
Yeah,
I love these things that can happen in that 5-minute sort of window. Just like, I mean, I even do it like sometimes, if I like right at the beginning of my lunch break or something like that, just to be like clear my mind, clear the space a little bit, because it gets
they're all things you could do in your office too.
Yeah, totally. Yeah, that's great.
Just have a chair and just have enough room to move a little bit. And
oh, that's fantastic. Thanks for that little pointer. I love those things that are just like, where are they coming? Yeah. That's awesome. Cool. So I guess the last thing that I just had on here was really about the memory supplements that are sold, but kind of have like the research is, about safety and everything is kind of like not 100% there. The CDP choline, it does seem to be very safe. It is actually sold as a prescription medication in Europe, and it's kind of being broadly marketed as being something for memory and Alzheimer's prevention, but actually very specifically the studies where it's shown to be effective is when it's vascular. So when it's really about a person's vascular health and plaquing of the arteries, coronary artery disease, that kind of thing. CDP choline seems to be helpful in those kind of areas, where people have more of like the ischemic strokes, which means there's not enough oxygen going to parts of their brain, and so they have a stroke because there's plaquing of the arteries that then cause difficulty for that, or a clot that causes difficulty getting oxygen to that part. So I think that CDP choline has a very specific sort of thing, application where it's very effective, but whether or not everybody should be buying it because they want to improve their memory is kind of another question. I don't know for sure. I wouldn't necessarily personally recommend it. I don't think there's any major huge concerns, but I also don't think it's kind of something that I would recommend personally. It also can be quite expensive as well. The Bacopa moneri is an herb that's been around for a long time, so I think it's pretty safe. Again, there's some studies that show no benefits. There's some studies that show some promising benefits. It's kind of a mixed bag. There are very specific contexts that I use it for. People have kind of signs of because it is one of the big mechanisms of it is that acetylcholine esterase inhibition. So it slows down the breakdown of the acetylcholine. And so when people have sort of symptoms that are consistent with low acetylcholine, I'll use it in that kind of a scenario sometimes. But again, it's kind of one of those ones that I'm sort of like waiting to see. I'm sure there'll be more literature about it, more sort of understanding of it moving forward. There's also kind of this, one of the things was really whether or not it's like a short-term type of a benefit versus long-term doesn't seem to make as much of a difference. So it might work really well. There's a lot of things like this that are in the nootropic, which is like the brain health thing that, that might have a very good short-term benefit, but not necessarily a long-term benefit, partially because our brains are so good at adapting to things. And the way to understand that the best from a personal experience kind of level is caffeine in coffee. Is that a lot of times if you haven't had coffee in a long time and you have a cup of coffee, you're like getting it all done, like really quite energetic. And if you do have coffee every morning, you drink your coffee and it's like, basically just to be able to be productive, be kind of like status quo, you're not really necessarily feeling very energized by that coffee. So that's a good example of how well our brains adapt to things and sort of get accustomed to it in a way that makes it kind of something that we end up wanting to have more of. For further reading, I do The End of Alzheimer's is a good book about all of the sort of metabolic components of Alzheimer's and the relationship with coronary artery disease and diabetes and oxidation levels. And The Angel and Assassin, which I mentioned about microglial cells, is just a really fascinating read if you want to just kind of be in the space of wonder about our bodies and brains and just how they work. So yeah, so that's everything on memory. If anybody's, watching this or listening to this as a recording, I'm happy to have questions come in. And you can email me or you can ask me at your next appointment, whatever you'd like. So.
Okay.
Well, thank you so much.
Thank you.
Take care. Have a wonderful rest of your day.
You too. Bye-bye.
Bye-bye.